Welcome to Primary Sense in Practice, a series of short practical videos developed for healthcare professionals. In this series, we'll show you how to use and understand Primary Sense reports so you can make informed, data-driven decisions in your everyday practice. Let's get started. Primary Sense is provided at no cost to general practices by your PHN, making it the most widely used and preferred clinical decision support tool across Australia. All data used by Primary Sense is fully de-identified, protected by strict privacy measures, and stored securely within Australia, and it is never sold or commercialised. To run a report, click on the Primary Sense icon on your desktop or taskbar. From the expanded menu, click on the Reports icon and double-click on the desired report you'd like to run. Let's take a look at the PIPQI 10 Measures report. The PIPQI 10 Measures report is based on the measures outlined in the Practice Incentive Program, specifically the Quality Improvement Incentive. This report is structured around 10 nationally recognised improvement measures that are designed to support general practices in enhancing patient care and population health outcomes. These measures include 1. Proportion of patients with diabetes with a current HbA1c result, 2. Proportion of patients with a smoking status, 3. Proportion of patients with a weight classification, 4. Proportion of patients aged 65 and over who were immunised against influenza, 5. Proportion of patients with diabetes who were immunised against influenza, 6. Proportion of patients with COPD who were immunised against influenza, 7. Proportion of patients with an alcohol consumption status, 8. Proportion of patients with the necessary risk factors assessed to enable CVD assessment, 9. Proportion of female patients with an up-to-date cervical screening, and 10. Proportion of patients with diabetes with a blood pressure result. Practices are encouraged to read the sections in the user guide on patients returned in the PIPQI reports with diabetes, calculating RAC-GP active, calculating smoking, and calculating alcohol, as there are complex rules defined by the Practice Incentives Program quality improvement measures, technical specifications, which Primary Sense reports must follow. It is important for practices to understand what is being returned in the reports. Patients must be RAC-GP active and have visited a particular primary healthcare provider 3 or more times in the last 2 years. The Primary Sense PIPQI 10 Measures report enhances these measures by breaking them down into 22 sub-measures, each accompanied by a numerator, denominator, and percentage. This structure provides a more granular view of your practice's performance and highlights areas for targeted improvement. To illustrate, within QIM2 smoking status, if 90 patients have a smoking history recorded, this figure forms the denominator across all subcategories. If 16 of those patients are identified as ex-smokers, that number appears in the numerator for that specific sub-measure. This level of detail enables practices to identify gaps in clinical documentation and improve data quality. Primary Sense supports this process by highlighting patients with missing data, thereby facilitating more accurate reporting and better informed quality improvement initiative. Primary Sense also makes it easy to identify patients with missing data and improve data quality percentages in the accreditation report. To do so, run the Patients Booked In with Missing PIPQI Measures report. This report identifies patients with missing measures who are scheduled to visit within the next 2 weeks from the report's download date. Clicking on the report columns will sort and rearrange the results alphabetically, chronologically, from high to low or low to high. If a measure has already been recorded, the corresponding field in the report will appear blank. Where a measure is missing, an N or a description of the missing measure will be displayed. The Existing Appointment column displays upcoming patient appointments and can be filtered to display the most recent upcoming appointments first, allowing you to identify and target patients and fix missing data of patients booked in. This provides for an efficient and streamlined approach to capturing this data, in comparison to a recall list or clinical audit of all patients missing the data. If needed, the report can be exported in Excel or CSV format and printed for your records. So, how can we turn these reports into meaningful quality improvement activities? Some quality improvement activity suggestions include identifying patients who should be marked as inactive, increasing the recording of HbA1c or blood pressure in patients with a diagnosis of diabetes, documenting social history such as smoking and alcohol use, and ensuring BMI and ethnicity are recorded. Let's take an example of a practice wanting to increase the percentage of type 2 diabetes patients with a recorded HbA1c. We will use the National Quality Improvement Template, adapted from NINCO, to discuss this example of focused QI activity. First question to ask is, what are we trying to accomplish, or what's the aim? Answering this question helps in developing a SMART goal for improvement. For example, in 6 months, our team will increase the total percentage of type 2 diabetes patients with a recorded HbA1c from 30 to 75%. Second question to ask is, how will we know that a change is an improvement, or how do we measure it? For example, utilising Primary Sense PIPQI 10 measures report to monitor overall percentage increase in the patient data. The third and final question in the thinking part is, what changes could we make that will result in improvement, or what are the change ideas? Some ideas for this focused QI activity could be: implement a process of admin staff running a daily primary sense report, such as the patients booked in with missing PIPQI measures, and flagging patients requiring their information inputted by adding a note in appointment details. Identify and recall patients to have a pathology test for HbA1c. Implement practice health promotion posters highlighting booking for chronic condition care. Contact your PHN for support or to learn more about establishing and enhancing quality improvement in your practice.